Hello, my name is Solitaire Sabota, and I'm going to talk about military and PTSD for Colorado Christian University Psychology Senior Seminar. When you have PTSD, the world feels unsafe. You may have upsetting memories, feel on edge, or have trouble sleeping. You may also try to avoid things that remind you of your trauma, even things that you used to enjoy. While these experiences are normal immediately following a traumatic event, they typically improve or subside over the course of a few weeks to a couple months. Ongoing symptoms beyond this time frame, worsening symptoms, delayed onset of symptoms, or reoccurring symptoms may be a sign of PTSD. So what is PTSD? This is an acronym that stands for post-traumatic stress disorder. This is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event, such as natural disaster, a serious accident, a terrorist act, war, combat, rape, or other violent assault. PTSD is not limited to those who have military service, but the percentage of those in the military who experience PTSD is far higher than the average population. Statistics show that from 11 to 30% of veterans suffer or have suffered from PTSD during or following their military service. There are four main types of symptoms that are associated with PTSD. The first is reliving the event or re-experiencing the symptoms. A person may re-experience the event and/or symptoms at any time, even many years following the initial trauma. This might include nightmares, flashbacks, sights, sounds, smells that trigger them to relive the event. The second symptom is avoiding situational reminders. They may attempt to avoid situations and/or people that trigger memories of the event. They may avoid talking or thinking about it, avoid crowds, driving, movies that are associated to the trauma, or anything else that triggers memories. They may intentionally keep busy and not seek help so that they can avoid thinking and talking about their trauma. The third symptom is negative changes in beliefs and feelings. Their thoughts and feelings about themselves and others are altered due to their trauma. They may lack positive or loving feelings towards others, which causes them to avoid relationships, especially deep relationships. They may forget about parts of their trauma and not be able to talk about it. And they may think that the world is a dangerous place and that they can't trust anyone. The final symptom is hyperarousal, feeling keyed up or jittery, constantly on alert and on the lookout for danger. Anger and irritability may come on suddenly, and they may experience difficulty sleeping, trouble concentrating, be startled by loud noises or surprises, and often want to be in a defensible position, particularly in public, such as keeping their back to the wall when they're in a restaurant. So is there a cure? Well, there's many treatments, but the answer as to whether there's a cure or not is sometimes for some people. For some people, receiving treatment removes all of their symptoms. For others, they may experience less symptoms, or their symptoms may come on less often, even going years between occurrences. Or they may find that the severity of their symptoms is lessened. With treatment, the goal is that the symptoms that do occur do not interfere with everyday activities, work, or relationships. So the treatments. The two approved treatments are psychotherapy and medication. Treatment provides the opportunity to improve symptoms, improve personal and professional relationships, and improve the overall quality of life. For psychotherapy, there are 3 normal therapies that are used for treating PTSD. This includes cognitive processing therapy, which teaches how to reframe negative thoughts about the trauma. Often this includes talking about the trauma and sometimes even writing assignments. The second is prolonged exposure therapy, and this teaches how to gain control by facing negative feelings. This often also includes talking about the trauma, as well as intentionally doing some of the things that they've avoided since experiencing their trauma. The final is eye movement desensitization and reprocessing, which helps to process and make sense of the trauma. Simply, this is recalling the trauma while paying attention to a back and forth movement or sound. Medications are often used in conjunction with psychotherapy. The 2 medications that are typically used are SSRIs and SNRIs. These are initially used for depression, but they've found to be effective in treating PTSD as well. There are many beneficial complementary therapies, but it is important to note that these are not replacements for psychotherapy and/or medication. They are great options to assist with professional therapy and for lifelong support and healing. Some of these include group therapy, service or emotional support dogs or animals, mindfulness, exercise, yoga, dancing, and many others. There's lots of local and national resources available for different complementary therapies for PTSD. So how you can help. If you know someone with PTSD or think you know someone with PTSD, be willing to listen but don't push. Make sure that they know that you are willing to hear their feelings and you're there to support them if and when they're ready to talk. If they are ready, choose a time and place to talk where you won't be interrupted and there's no distractions. And then really listen to them. Ask questions to make sure you understand what they're saying, but don't second guess, don't make assumptions, don't give advice, and don't say, I know just how you feel. Recognize when to take a break. If the conversation seems to be getting too intense for them, give them the opportunity to pause or take a break and reconvene at a later time or date. Again, don't push. Let them know that you are available when they're ready. And get help. There are so many resources available. Encourage them to get help and offer your support to them through the process. And if there's any talk or behavior that makes you believe that they may attempt suicide or other self-harm or harm another, please seek professional help as soon as possible. And if it's safe to do so, discreetly remove pills, firearms, or any other objects that might be used for harm. Get help for those you care about and encourage them to use the resources that are available. Here are some emergency resources. Of course, 911, the number for the suicide prevention hotline, the veteran crisis line, which also includes text and chat options. Remember, there is help available. These men and women have fought for our freedom. It's our turn to fight for theirs. Thank you.